Hello, I'm Maia Ellis, and today I'll be presenting our evaluation of a remote surgical prehabilitation service at UCLH. Prehabilitation is increasingly recognised as an important part of perioperative care, helping to optimise patients before surgery. With growing pressures on services, digital delivery has been promoted as a flexible and accessible alternative, especially for patients with a high symptom burden or geographical barriers. However, there is still limited real-world evidence evaluating how effective remote prehabilitation is using standardized outcome measures. So the aim of this study was to evaluate changes in both patient-reported and physical outcomes within our remote prehabilitation service, comparing patients at baseline, preoperatively, and postoperatively. We conducted a retrospective cohort analysis of routinely collected data from May 2023 to January 2026. We assessed 4 key outcomes: quality of life using EQ5D5L, nutritional status using PGSGA, fatigue on a 0 to 10 scale, and functional fitness using the 30-second sit-to-stand test. Looking first at preoperative outcomes, from baseline to pre-surgery, we saw clear benefits. Nearly half of the patients, 47.5%, improved in quality of life. 37% improved in nutritional status, 40% improved in fatigue, 13.7% showed improvement in functional fitness, and many others remained stable. Postoperatively, results were more mixed. Around 30 to 43% of patients improved across measures, but a similar proportion worsened, particularly in fatigue and physical function. It's also important to note that missing data, especially for physical outcomes, reached up to 20%, which impacts interpretation. In conclusion, remote prehabilitation is associated with meaningful improvements in quality of life, nutrition, fatigue, and physical function before surgery. Post-operative findings were more variable, which likely reflects the expected recovery trajectories rather than a failure of the intervention. Overall, these findings support remote prehabilitation as an effective and scalable model of care, and they highlight the importance of the preoperative window as a key opportunity for optimization. Moving forward, improving data completeness, particularly for physical outcomes, and strengthening post-operative follow-up will be essential to better evaluate long-term recovery and service impact. Thank you for listening.